So this is Hack to Shape the Future of Healthcare. Thank you so much for being here. This information session being held on the 26th of April. And during this, we're going to try and showcase to you guys as much as we can about the hackathon and about the top prize, which is our incubator here in Berlin. So let me run you through now the Meetup agenda. So I'm providing this welcome. My name is Ben. Lovely to meet you all. In a few moments' time, Maren Leisha, our program director and co-founder, will run us through an introduction to the hackathon. Shortly after that, we'll then go through insights from the incubator, our program manager, Lucy. And then we have some special guests as well, who will be joining us for an insight into the incubator, but also into the hackathon as well. And then we'll get to the Q&A. So for anyone who's just joined us, you can see on the screen now, hopefully, the Meetup agenda. So do ask your questions as we go along and write them in the chat. And at around 5:45, you can see there, CEST, we will run through questions that you've asked in the chat. So with that, I've already mentioned a bit about housekeeping. Just please do keep yourselves muted. Yeah, so there's our special guest you just saw. But yes, this is Hack to Shape the Future of Healthcare. Yes, I'm delighted to say that Susanna, who's from a startup team currently in our cohort, so with us in the program Vision Health Pioneers Incubator, will be saying a few words later on and share an insight into what it's like as a scholar with us. And also I'm delighted to say Johannes Stanley, who's one of our coaches here with the incubator, will also be able to say a few words about his role and the great work that takes place with the coaching and mentoring that we provide for our startup teams. But I'm now delighted to hand over to our program director, Maren Leisha, who will take us through the hackathon. Please do keep yourselves muted during the call. If you have any questions as they come up, please do put them in the chat and we'll address them later. But with that, I will hand over to Maren, who will take us through the hackathon. Over to you, Maren.
I'm still muted. I followed the rules and muted myself. So thanks for joining and thanks for the introduction, Ben. Let me quickly walk you through the hackathon and why we are doing it, because some of you also are aware what Vision Health Pioneers is doing, and you might also want to understand how the hackathon is part of the current onboarding of the last cohort we will onboard in 2022, the cohort that is coming in July. So we actually have not done a hackathon for Vision Health Pioneers before. We did a hackathon a couple of weeks ago for one of our other incubator programs. And what we learned is that we had the chance to actually bring together people that might not have been together without the hackathon. But we also learned that there are ecosystems out there, there are a group of very interesting people out there that most likely would not be aware that Vision Health Pioneers exist, or they are not active in digital health right now, but want to explore a little bit more. So we set up that hackathon also to reach out to the new kids in town, either in Berlin or in Europe, and everybody that is most interested in actually doing something in healthcare. We expect up to 50 hackers. If you would go to Taikai, this is a platform we are using. You see that more than 10 people registered already. Some are here in the call. The hackathon is open for individuals, but also teams that already formed. So depending on what group you belong to, there will also be activities to either extend the team that you have or find the right team if you come in as a single person. We will have workshops. This is the reason why it's not a classic 48 hours hackathon. It's actually a week that spreads out with multiple activities. We also have mentors on board that help you to work through topics. There could be also topics that are not necessarily one-on-one attached to the hackathon, but maybe it's something that you have been working on within your young team already. So use it also as an opportunity to get in touch with people and also in the workshops to reflect on certain topics. We will have two challenges. One challenge is coming from a pharmaceutical company. The other one is from a medtech company. And one challenge is an inspiration, I guess. The other challenge is quite concrete, focused on a very clear product. But these are just challenges that can guide you, and I will dive a little deeper into that. So feel free to also bring your own ideas. We are very happy to see what you're working on. So the two challenges that I'm going to introduce are also for inspiration in case you don't come with an idea, but would love to work on an idea during the hackathon. We have a couple of jurors. Not every juror will be announced today, so be aware, but one of the jurors is actually here in the call. So at least we can show you a few people that will also look into what you do at the end of the Hack Week. As I said, we are super open. You can be a developer, you can be a graduate from a university, you can be a freelancer. Of course, we're always looking into healthcare professionals. So if you have not entered the startup space yet, but would love to learn a little bit more on how to build technology products, I think that is a good opportunity to get a first idea. Actually, this is a picture on the right side from some people from our current team. You also see F6S teams are also more than welcome. For the ones that have been in closer contact with Vision Health Pioneers, you know that we usually find the teams in a process that is powered by F6S. It's a platform where we actually ask teams to upload information. And in the past, we looked into these applications, the written ones from the written point of view. But we also learned that we would love to work closer with the teams together. We would love to see them pitch a little bit more. So this is the reason for the last cohort this year. We also introduced the hackathon. And as I said, doesn't matter if you're a team that has worked together for quite a while, if you're an individual, or if you're looking for an additional team member, or if you're looking for a team, see it as an opportunity to also connect to people. And maybe something great comes out of that. And I think we will also learn from Susie, that is part of Team Alois, how they did it, because this is also a team that used the hackathon to find each other. The main prize, and this is something that my colleague Lucy is also explaining, is a scholarship, which is 20,000 euros per person, because we have a program set up in a way that teams between 2 and 4 people can join. And again, just as a heads up, there's a little bit more information coming about that from my colleague Lucy, so I don't want to dive too deep into that. But of course, the hackathon could be your starting point to actually start your founder career in healthcare, and a 10 months program for sure would give you the opportunity to work more intensely on the ideas, doesn't matter how young they are. We have a few categories for you. If you would go on our platform, and we are diving a little deeper into our tech in a few minutes, you would see that we have one challenge that is provided by Lohmann and Rauscher, which is a company that also has compression and diabetes products. So they are quite broad. They also already are on the market. But what they also see that the user journey that people experience, patient experience with their product called ReadyRep is very different. So ReadyRep is something that makes compression therapy easier for patients with lymphatic diseases. And for sure, this is something that a lot of people are suffering from. And ReadyRep is quite undigitized right now. So it's definitely an opportunity to dive a little deeper into that. And if you don't have a challenge, an idea yet, feel free to explore the challenge by Lohmann and Rauscher. There's a second challenge that has been inspired by actually a person that is in the room here, Sylvia Bates, because when there's a discussion about like what's happening right now, what will have an impact, there was some inspiration coming from Bayer. And this is clearly the metaverse. I think this is a very exciting and new topic. We did not have a team yet that was fully immersed in the metaverse. We had not a team yet that worked with NFTs. And the question is that something that is relevant for healthcare? How could it be relevant for healthcare? What does it mean for the patients? But also, what does it mean for the caregivers in general? So I'm very excited about that challenge, because I'm not an NFT expert, I'm not a metaverse expert, and I think I would be able to learn a lot from that. We also, of course, have the opportunity to bring our own ideas. Right now, and you will also meet some of the people that are part of our cohort already. We focus a lot on prevention and treatment solutions. Hard and software solutions are more than welcome. So if you use the May hackathon to explore a little bit, if you would do it on site, there's also a maker space. There are also 3D printing opportunities in the co-working space that we use for the hackathon. And again, if the idea would be suitable for the German market, it would be more than perfect, because my colleague Lucy is also explaining a little bit how we work, what kind of local and international partners do we have, and what could be a growth opportunity for you within this partner network. And of course, what would be amazing is that within like 10 months, after joining in July, you would be able to actually develop a very strong MVP that gives you also a good starting point to move into the e-health environment, to do digital health in a long-term way.
Ja, jetzt mache ich es.
Could somebody please mute? That would be amazing. So I think this is something a lot of you have ideas, a lot of you have thoughts, and especially the teams that already put in some ideas on F6S. We have seen your ideas, the exciting ideas, so we're very much looking forward to learn more about these ideas. As I said, also if you have questions related to what kind of startups and ideas we supported in the past, note it down, send a link or information in the chat, and then we will pick it up in the Q&A session. Some important dates for the hackathon. So we officially kick it off today. We actually, I think 2 days ago, we opened our registration platform. So there's a lot of information already out there, and we are also sharing some of the information here. On the 11th of May, we will do another meetup that also is targeted towards everybody that has not found the perfect team yet, that is either looking to join a completely team that exists, so to complete the team and make it a round 4, or also individuals that are lonely soldiers, as we usually say, and that want to find like-minded people to work together. On the 16th of May, we officially also in an online environment like this will kick off the week. And on the 18th of May, we will also welcome everybody that is in Berlin, wants to stop by, also wants to do part of the hackathon in person, to the co-working space where we also did our past hackathon. It's called Drivery. It's not with a very specific healthcare focus, but we love the place so much. And it's pretty cool to spend time there. And there's also great infrastructure of Wi-Fi, 5G, but also some other gadgets, especially if you want to work on hardware products that you could use. On the 20th of May, so the 18th, 19th, and the 20th are the most intense days, is a day where we also want you to present what you have worked on. It could be something, again, that you started completely new on the 16th of May, but it could be also something that you brought in. It's important that the teams that brought something in also give us an idea what did they bring in and what did they work on during the hackathon. And on the 20th of May, we will have a public event where a jury is also giving you feedback, but most importantly, a jury is also giving you scores based on a blockchain technology. So you instantly also see how many tokens you got from which mentor, which coach, and also what does it mean? Are you in the incubator, or also if your number of tokens was not enough to actually reach the first top 10 people that will have the chance to enter the incubator on the 1st of July. I talked a lot about Taikai, and I'm also going to deep dive a little bit into that later on. We want every team to register. As I said, it's also quite important because the platform that we use is run on a blockchain technology, so everybody can also use it. If you want to join another hackathon later on, everybody will see how successful you have been in past hackathons. And it's a great opportunity to also get more information about the other participants that register and mix and match. There are team leads, ideally one person per project, per team, that is also required to quickly upload some information on the project, the idea you want to work on. So we also have a kind of sub-page for everybody to upload the information. It's a closed space. Only the people that are invited will see it. And in this closed space, you can also exchange ideas. You can add links, and you can also, of course, add a description description that at the end is quite important for the mentors and the juries to better understand what you're working on. There are also dates on it, so it's a good opportunity. You will have all the links to all the resources that we have. You will have profiles of the coaches, the mentors, and the jury members, and you will also have an overview about all the Zoom links that you need to enter the coaching and the mentoring sessions at the end. This is how the platform looks like. Some of you are registered already, but I'll also will take some time at the end of the session to walk you through the platform. And you see rules, prices, projects, participants, everything is quite structured. There's one thing I wanted to point out. We have a Slack channel. It's a Slack channel that is active across all the incubation programs that we are running, and also has mentors, coaches, but also alumni from the current cohorts in it. So it's a great opportunity to also expand your network, and everybody can join that Slack channel. So if you see the turquoise button here, this is something that you can also do. So you can also get in touch with everybody else. But let's talk a little bit more about the incubator. And I would like to hand over to my colleague Lucy that give you a little bit more information about why you should battle in the hackathon to actually join the incubator. And of course, it gives you also a better understanding what could be your life in the next 10 months here in Berlin. Lucy, the stage is yours.
Yes, thank you, Maren, and hi everyone, and happy to meet you all today. Yes, so let me give you a few details about the incubator, and I will start first with a short history. So our incubator was founded in 2019, and we are publicly funded by the European Social Fund and the Senate of Berlin. We are supporting early stage startups in the healthcare field, and in 2020 and 2021, we have already supported 13 startups altogether within 2 cohorts. And now in 2022 and 2023, we have the pleasure to support more startups, so 12 to 15 in total. And we have already launched the cohort 3 in January, cohort 4 in April, and now our last cohort will start in July. And this is why also this hackathon is organized, because for the selection of this last cohort. So our incubator offers different things that Maren already mentioned. So first of all, it's a 10-month program that I will explain in more details afterwards. We have also a co-working space, so in Berlin Mitte, because so all the program is Berlin based. And this equity-free scholarship funding of 2,000 € per member per month, knowing that every team is composed with 2 to 4 team members. That's why then you end up with 80,000 in maximum if you are 4 team members. So about the program, so on the next slide, you can see that our program, Maren, can you just go to the next slide? Thanks. So our program is structured into 3 phases because we try to provide the structure in order to help you or guide you through the startup journey in healthcare. So knowing that usually our startup joins the program with an idea, and now they want to turn this idea into a business concept. So that's why our program is structured into phases from validation of the concept, then developing a first prototype to create first traction as well, and then preparing for follow-up funding or finding some partnership for then your next milestones. So in every phase, there will be, or there are some specific program milestones, and we support you with reaching those milestones through our training and coaching program. So within each phase, you get access to coaching, training on different topics. So for example, on phase 1, we will focus more on strategic design, business modeling, regulatory, with also Johannes Stanley that is here today. On phase 2, we focus on more tech topics, or also data privacy, also marketing, some details on business, and phase 3 is more about fundraising and preparing for the after program. So yeah, this structured approach aims to help you with developing your business case, and then also making sure that you have some let's say follow-up milestones after the program. So to join our program, there are a few eligibility criteria that you can see on the next slide as well. So as I already mentioned, it's an early stage program, so meaning that our team joins the program without having founded a company yet, or if they have a company, it's not older than 3 months, so it's very young teams. Also 2 to 40 members maximum. So we don't accept solo entrepreneurs, but we hope also that this hackathon will help solo entrepreneurs to, find some teams to join. It's Berlin based, so meaning that all our members or all the members of the program needs to be resident in Berlin for the whole program length. Also because we are publicly funded, the startup can't have any other funding or private funding besides the scholarship. So prize money or competition money, yes, are still accepted, but let's say that you're not allowed to have some significant shareholders within your startup if you have already founded your company. The idea should be also applicable to the German market, because all our program content also focus on the German or European market. That's why also we make sure that it should be suitable here. We also welcome internationals under working or job seeker visa. That's also possible. We also try to help internationals to get or switch their visa with our partner, with Berlin partner, for example. So that's something we can support. And ideally, each team should have at least 1 German speaker and 1 person with a background or experience in the healthcare field related to the product that the team wants to develop. So yeah, it's easier for the team then to, let's say, create partnership or access to the network and yeah, access to the network. So yeah, this is the eligibility just as a quick glimpse. Of course, during the hackathon, we also have a chance to discuss that in more details if you have questions. But for the moment, then yeah, just for the last slide, just wanted to tell you more about our network. So since we are founded in 2019, we've been able to create, let's say, a large network composed today of about 80 plus mentors and ambassadors that are usually professionals in various healthcare fields, like pharma or healthcare insurance companies, but also in corporate law, product design. So it's very, very diversified across all across all the expertise that you need to develop a startup in the digital health space. Beside that, we also have some great network of coaches. So coaches that are here to support you with a training program, but also with specific coaching plan across the program phases. So those coaches are very familiar with the incubator setups. They've been involved with us since the beginning. They all have a background in healthcare or very familiar with working with our young startups, and yeah, they provide some quite intense support for us. We also have partner organizations from different fields as well. So for example, Sana Kliniken or Baumer or Jonas. So that act with giving specific services or access to testing fields or specific experts as well when it's needed. And yeah, besides this community, we also have now a community of entrepreneurs, because we have already run some cohorts or some some cohorts previously. So now there are also 40 alumni that were part within the 13 startups of cohort 1 and 2 that are still quite involved with us. And now also 21 additional entrepreneurs that are part of cohort 3 and 4. So yeah, the community is growing and very supporting as well our program for sure. Yeah, I think this is all for the program overview, and of course I can answer any questions if needed later on.
Cool. Thank you very much, Lucy, and thank you, Maren, for both providing us all with a great overview of the hackathon and the incubator. Now, folks, I'm delighted to say that one of our great coaches that we work with, Johannes Stanley, is joining us for this session. And I'd like now, if that's okay with you, Johannes, just to ask you a couple of questions, just to give the audience a bit of a glimpse behind the curtain of how things happen at Vision Health Pioneers Incubator. So may I ask you, Johannes, if you would mind briefly introducing yourself and maybe just answering a question on what excites you most about working with first-time founders in healthcare?
So what I find really fascinating about working with the teams within the incubator is that there's just this very broad range of different ideas and different innovations that are brought up by the teams. And then throughout the incubator, they just learn so much about all the complexities of healthcare and how to handle them and how to actually shape their innovation in order to deal with all these complexities and actually to make a good fit for the market. And I find that great to make a contribution there, I have to say.
Excellent. That's great to hear. That's so positive, and hopefully gives the budding entrepreneurs in this core a bit of a glimpse into how you approach your work. Would you mind just providing a bit of an introduction into your role and what you do, just so people have more of an idea of yourself?
So my role as a coach is actually twofold. So number one, I run workshops with the teams, actually with all teams together, and giving them information about mostly regulatory aspects of digital health innovation. And second, I do team-based coaching sessions. So one-on-one with individual teams where we, number one, go over their roadmap, not only, but especially for regulatory aspects of their developments, and then also see how their general product idea, their general product roadmap can actually fit into regulatory requirements, and how these requirements can actually be intertwined with all the other aspects that need to be taken into account, like marketing or business or other legal aspects, and especially technical aspects, right?
Wonderful. Thank you so much. That gives us a really good insight. And folks, if you have had a look on the Taco platform, you'll see that Johannes will be one of our special coaches providing a session during the hackathon itself. So if you do sign up and join in, you'll be able to find out a lot more about what Johannes has just been sharing. So Johannes, thank you for joining us. And I'm also delighted to welcome into this call Susie Bien from Elios, one of the startup teams who are currently going through the Vision Health Pioneers Incubator. So Susie, thank you for being here and joining us. And I'm delighted and hopefully correct in saying that before you joined our program, you took part in a hackathon. So I think it would be wonderful if you can give us a glimpse of what that was like to go through a hackathon.
Yeah, of course. Thank you so much for having me. It's nice to speak to everyone. Yeah, so for us, the journey started in October, actually, when we took part in a hackathon that was not organized by Vision Health Pioneers, but it was a different hackathon that has certain links to the program. And for us, it was a really great way to quickly test out how we liked working with one another. I think we were all motivated to do the same thing. So we all wanted to try our strength at building a company, and we all were interested in the same area. So our company is focusing on dementia and trying to build technology for people who suffer from dementia. So as soon as we established that we have that in common, then a hackathon would really provide us a great way of testing out quickly how you work with people, whether you find it easy to get along, whether you appreciate their inputs and ideas, whether you can discuss and sort of find common ground, and also how you handle disagreements or competing ideas. So for us, it was a really great way of testing this out quickly, and it provided us with the base for application to get into this program as well. So out of I suppose 2.5 or 3 days worth of work, it felt like it really kind of launched us into a really good adventure. So it was super worth it.
Excellent. Well, I think that's really interesting to hear, and hopefully fascinating for those of you who are joining us in this call who maybe are looking to form teams and join teams. I think Susie's provided us a great overview there of how you can go through quite an intense period to see if you can work well together. May I ask Susie also, how has the experience been so far in the Vision Health Pioneers Incubators program? You joined in January this year, so it's been a couple of months now. How have you found it so far?
Well, I think the program has been kind of perfectly tailored to where we're at in terms of our company and the stage that we're at, because it takes you from the very beginning of how to form your ideas and how to kind of productize them, and then sets these really clear objectives and milestones of how you think you should develop your ideas into a product that's actually ready for the market. So I think for us personally, it was great. We've had a lot of support, a lot of input from the coaches, from the mentors. Everyone's been very responsive, and we definitely wouldn't have been as far along if we didn't take part in this. So it's been a very positive experience.
Excellent, cool. Thank you so much for those answers, and we wish you the very best of luck with your continued journey with Vision Health Pioneers Incubator. Big thank you, Susie and Johannes, for both your insights then. So now, folks, what we're going to do is dive into the questions and answers that I can see some of you have been writing in the chat. And then do stick around, because Maren alluded to earlier on, we will take you on a walkthrough on some of the Taco platform, which, as Maren said, is the home of the hackathon, and where you'll hopefully be signing up as a participant and then entering your projects or joining projects on there as well. So what I'll do is I'll go through the questions now in the chat, and then I'll put them to our colleagues in the Vision Health Pioneers team. So I can see here, one of the questions is, how important is the German speaking requirement? Now, Lucy, I think you spoke about this. Would you mind answering this question for us, please?
So I would say that generally, from what we could experience also with the previous cohorts, is that having someone able to speak in German is very helpful to access to the network, but also to conduct any interviews, to better understand how is your market working, if you need to speak with medical doctors or nurses and so on. So this is definitely a plus. I wouldn't say that it's definitely a no-go. Then you can, still find some ways around, but I would say on the long-term vision, it's definitely valuable for you to get someone that is able to speak German if you want to tackle here the local market. But yeah, from a more European market entry vision, I guess this is less a problem. We did have teams in the past that joined our incubator without speaking necessarily German fluently, and it could work, but it was challenging. So I would say that this is definitely a plus generally.
Cool, thank you so much, Lucy, and hopefully that answers the question there. And actually, I can see a similar question was asked with more an example of a situation of being fluent in English but not being familiar enough with German. So hopefully that also answers your question. If it doesn't, please do write in the chat and we can address it. But I think Lucy's covered it all there. Now, another question we have here is, what would be the working status of team members while in the incubator? Freelance or employee, who would pay for health insurance? So I think actually, Lucy, again, that would be a great question for the first part for you to address, if that's okay.
Sure. So if you get enrolled in the program, you will get a scholarship contract with us. So this is not an employment contract, so you won't get the employee status with us. Usually, yes, it can be self-employed or freelance statute. and you will get so 2,000 euro on your bank account, and you have to pay your own health insurance with it. So meaning that this is not so you get the 2,000, nothing will be deducted from the 2,000 for your healthcare insurances, and this is something you have to take care about on your side, I would say.
Excellent. Thank you again, Lucy. And hopefully that answers the question we had there. So another question we have here is, would a health startup that optimizes the supply chain be eligible? Now, I think that would be a good question, maybe for Maren this time to answer. Can I put that towards you, Maren? So would a health startup that optimizes supply chains be eligible?
Yes, we have one company in our incubator already that is focusing on easier making the laboratory work easier by providing home kits and coordinating like the transfer of bio kind of products from A to B. I think it depends a little bit in which sector you are on. I think what we are aiming for is also solutions that are relevant for the German market. So there is a pain. I think this is quite important for us. And of course, there should be also a strong touch point to the healthcare market. I'm quite happy to look into that if you have very specific questions. So we can also schedule a mentoring session. I'm also mentoring and coaching during the hackathon, and we can dive a little deeper into that. But what we also learned is in the first phase, as Lucy says, we are also validating ideas. And we also had a lot of startups that reshaped their ideas a little bit, especially if the idea came from a different market. And we looked into them at much deeper. We also tried to figure out, this is what Johannes Stanley also mentioned, if from a regulatory point of view, such a solution could work in the market, who are the players, the stakeholders involved. I think this is also part of the work to run through such a program to figure out if this solution has a big problem, a big pain to solve, or if this is a solution that is something that might not be the most pressing one, especially here in Germany. But I'm very happy to jump into a quick session between now and the hackathon, or even during the hackathon, to dive a little deeper into that. So the answer is yes, logistic and healthcare is applicable, but then the question is as well, like, how strong is it attached to healthcare? And if the problem is a real problem for the German market.
Cool, thank you, Maren. Excellent. And I think this could also be another question for yourself, actually. It's what if you are a solopreneur? In my case, also the MVP will be ready by end of May 2022.
Solo entrepreneurs, unfortunately, ideally you're a team of two, a team between 2 and 4, but this is also one of the reasons why we do the hackathon. So it's an opportunity for you to also find another person. That doesn't necessarily have to be a founder, but you should be a strong team that likes to stick together for 10 months because this is a time frame, but also the time where both of you would get access to knowledge and a network. Doesn't matter if you decide at the end of the program if you want to found a company together. I think that journey is a journey that everybody is benefiting from. So this is one topic. So if you're a solo entrepreneur, not an issue if you find a second person during the hackathon. Within the Applied Data Incubator that we had, and we had the hackathon in March, there were some very new interesting teams that formed, and I think part of these people would not have met without the hackathon. So be open, try to meet like-minded people, and try to explore if somebody that you could meet during the hackathon is a person you could envision working together. If you already have an MVP, this is also not an issue. As Lucy mentioned, we support very early stage founders. So if you have an MVP, super cool. We would still validate the idea and the MVP with you. If you get a second or third team member on board, of course, you have more man and woman power to bring this MVP a step further. You could dive deeper into the topics you still have to cover, but of course it would give you also a different starting point at the end of the program. Everybody thinks 10 months is a long time, but I can assure you it's a very short time in a startup life because it happens so quickly. And of course it gives you a head start. What is quite important to add to what Lucy said, we do also accept companies from Europe, related to the incorporation status. So the perspective that Lucy showcased was mainly from a German point of view. So if you are an international company that is quite young, maybe not even a year old, but you already have incorporated your company, let's say in Poland, Italy, or Spain, but you have not launched your product into the German market, we would also consider you as the first-time founder in Germany. We would consider you as a company that has not been incorporated in Germany, because we also truly believe that the product might have to be adjusted to the German market. So this is the reason why we would treat you as a first-time early stage founders, which would make you eligible to the program. So
cool.
I hope that.
Excellent. Thank you, Maren. Perfect. And I think this question could be for Lucy this time. Can the team be remote in addition to German residents?
So what is for sure is that you need to be registered in Berlin as your primary residency, and working remotely. So our program is taking place on site at the co-working space. So many workshops or coaching sessions are happening here. So usually all the sessions happen on Tuesdays and Wednesdays, and some of them sometimes on Thursdays. So then we actually recommend all the teams to be here in Berlin on those days for attending all the sessions. And but of course, if then, I don't know, during the weekend or then Fridays, Mondays, you want to travel, that's possible. But yeah, it can't be exclusively remote during 10 months. But because the program is also happening here in Berlin at the co-working space. So yeah, of course, if, for example, some teams need to travel to meet some partners or to run some testing, to again, for business meetings and so on, this is completely fine to work remotely. So, but just not exclusively for all the time during the 10 months, I would say. Yeah.
And maybe I can add something.
Cool.
So this is also something, if you wonder why we don't have a kind of hybrid program first, because the program has run for quite a while. There are other incubators also that are supported by the public grants that we use. And I think the program was structured before COVID and before working from home, and working remotely was not as supported. And we also have a hybrid form with the on-site activities, because we truly believe that working together close to form, a relationship with coaches and mentors is quite important. And for many, it still happens in a physical way.
Cool. Thank you, Maren and Lucy, for those answers. Hopefully that answers the person's question. Another one here is, must the problem necessarily be relevant to the German market? So Maren, I'll put that one to you, please.
Yes, I think it's quite important to have a product that is relevant for the German market. I think some of you use an incubator like ours to actually also validate your product in the German market. The German market is in many ways different to other markets. We have concepts like DIGA that are now going to be introduced in France, but also going to be introduced in other countries. So Belgium has introduced something that is quite similar. But you have to be aware that especially in a market that is highly focused on a reimbursement scheme, of course, a different mechanism applies than in a market like Poland, where you have a lot of self-payers. So I think we also, as Lucy mentioned, have a lot of partners that have a very high expertise to support you entering the German market or establishing a healthcare product relevant for the German market. And I think this is a benefit that you have by entering the program. This is also a benefit that you have by being on site, getting to know these people in a much deeper way. And if your product is not suitable for the German market, I think you're also missing an opportunity at the end. And again, it's 10 months of your life. maybe then another program is better suited for you that focuses on the market you really want to establish your product in.
Excellent, thank you. Hopefully that addresses that particular topic in enough detail. So another question here is, our startup is based in the Netherlands and my resident permit is in the Netherlands. Any thoughts if it is necessary to relocate my residency to Germany and how to do it? So Lucy, I think you covered a little bit of that in what you were saying before, but do you mind addressing this question as well, please?
Yes, so maybe I will just start with the startup. So as Maren mentioned, if you have already created your startup in another outside of Germany, it's completely fine. You can join the incubator and really relocate or create here a company in Berlin, and we will consider you as a let's say first-time founders as a startup, and you don't need to respect this 3 months or this 3 months maximum existence, so that's completely fine. About you as a individual resident, so I'm not sure about your residence permit. For sure, you need to have a Berlin residency. So there is a specific process here in Berlin for you to get this paper that confirm and certify that you are now a Berlin resident. So we will give you some steps on the process. Usually you need to have a rental contract with a Berlin address, and then going here to the local administration to get this registration paper. And this is actually the paper that proves your residency here in Berlin. So I'm not sure about your residence permit and what is attached to it. You can also send me an email with more details, and maybe I can then help you more with that. But yeah, so I guess it depends on the permit you have, and then you can relocate to Berlin. I hope that answers the question.
Cool, excellent. Thanks, Lucy. I think it does, hopefully. So we'll just take the last couple of questions and then we'll do the walkthrough of the TechEye platform. So a question here is, can I participate in the hackathon remotely? I can answer that one. Yes, you can. You're very welcome to participate remotely. Absolutely fine. And another question here, it's the last question, and then we'll do the walkthrough, is for those applying for the VHP cohort, how exactly does the performance in the hackathon workshops play into the evaluation of whether we are chosen for VHP? As far as I understood, the pitch in the online form with pitch deck video and questions are not the only selection criteria, right? So I think that could be a good question for, I think, Maren to address for that one, or perhaps Maren and Lucy, but I'll pass the ball to Maren first.
So yeah, thanks. I think this was one of the questions from a company that applied via F6S. So the original process that we had was uploading your documents on F6S. And what we were looking for is, of course, coachability and team setup. We were looking into how suitable is your business idea for the German market? How far are you? And we had a multi-stage process that took actually quite some time. And was not as public as it is now. So we picked up different elements from the selection process that we had previously and brought them into a hackathon concept. So how would it work? We have a kickoff on Monday. We have multiple workshops. In these workshops, of course, we would share knowledge, and these workshops, especially with the coaches, and the one-on-one sessions that you would give you an opportunity maybe to reflect a little bit on the ideas. We have a dialogue now that we did not have before. So in this week, you could also work on making your idea stronger, adding new elements to your idea, and also working with experts already on shaping that idea a little bit more, especially if you apply from an international companies and you don't have that much insights into the German healthcare market, this is something that definitely helps you. This is one thing. Then we have mentors, experts in the field, but they are usually not in a workshop sharing methodology or facts, but they listen to you and also give you very individual feedback. They give you hints, they also share their own experience, and also, of course, could be a sounding board related to topic that is not facts and figure driven, but maybe also team topics or emotional things that you have in mind, because it is a big decision for somebody that has not started their own company. And if you choose healthcare, which is not the easiest field, but we all love it, and you might have doubts, or you might wonder, how a good team looks like, for instance, especially if you bring the hackathon teams together. There will be 2 specialized mentors that look into you a little bit deeper. It's comparable to a process we had before. The process was based on a 2.5 hour workshop where coaches and mentors helped you. So they look a little bit into coachability. Do you listen? Do you have the right questions? But of course, what's also quite interesting for us is how do you interact as a team? Of course, it's a little different than having a team that is formed and set up already, or forming a team during a hackathon. But of course, for us, it's not just important to evaluate you. It's also important for us to understand, how can we support? What do you need? For us, a startup, a team that is perfect, everything is set up, is not a startup we can support. We want to help you. We want to grow together with you. So we're also looking for teams that really need a support like the Vision Health Pioneers Incubator. So in this time frame, in this week, we want you to attend a minimum of 2 mentoring sessions and a minimum of 2 workshops. So you can also choose out of the workshops which is the topic that is most relevant for you. And maybe if you, let's say, come from university and you did a similar workshop already, of course, don't waste your time. Pick a workshop that is something that brings you forward. It could also be that out of the 2 or 3 team members that you have, 1 person joins, but for the mentoring, of course, it would also be amazing if you as a complete team could join. And then we have the public pitch. In the past, we did not have a public pitch. And again, a public pitch also gives you exposure. What we had in the past was a jury that looked into the back end of X6S and reviewed the information. As you also said, I think your name is Jasmine. So you uploaded a pitch deck, a video, and some more information. Instead of the video that we watched in the past without having the opportunity to ask a lot of questions, we now introduced a public pitch session where experts are asking questions. 2 of the experts are actually in the call. One is Jesus from Bayer and the other one is Sylvia from Bayer. And trust me, just having them and getting visibility to your ideas, I think it's a big, big win. So in the past, the teams did not necessarily knew which juror, which expert actually reviewed the application, and there was not a strong interaction between the jurors and the startups. Now there is. And the second or last layer comes on top, which I think also makes it more attractive for you. What we do is, and you also ask about the scores. So on the Taikai platform, the criteria are defined. So you clearly see what are the criteria that we apply. And these criteria will be applied during the pitch session. They are quite transparent. What we also do, and this is also the beauty about Taikai, each juror will get a certain amount of tokens. So each juror will give you a score, a number, and these tokens are added up. It will be also quite transparent. As soon as we click on a certain button, all the scores from the jurors will add up and will be visible in a so-called leadership board on Taikai. So you will immediately also see and get feedback. And I think this is also something that we have not done in the past. So in such a public format, of course, you could also learn much more. The question from the jurors, but also then the scoring. How do I compete with the other teams? What are the areas that the jurors criticize the most, but what are also the areas that the jurors actually like the most? This is the process that we do. But in the rules section on Taikai, there's much more information about, I think it's 5 criteria that we apply right now. And these criteria were mainly applied during the pitch session. But as I also said, of course, during the week, the coaches, the mentors will also see how you work, but we are not assessing the product or is the product perfect. I think we are more also having a look into, would you fit to the program? Would you benefit from the program? Do you have the right energy? We are not in a incubator like ours, see everybody as a single person. We see you as a unit of, at the end, 15 people most likely that are part of a cohort. So of course, we also want to have 15 entrepreneurs that have a good time. So we also look a little bit into how could you fit to the other teams, and would you be comparable, what coaching and mentoring you could work with. So saying that, of course, it's not necessarily hard facts that we could use as criteria, because every juror will most likely look into your story, your company from a different angle. But this is the reason that we also have not 1 or 2 jurors, not 1 or 2 mentors. We actually have a large number of coaches and mentors, and we will combine their feedback to a score. I hope that answered the question, and I can assure you, the 2 jurors that are in this call, Jesus and Sylvia, are true experts. I think, Jesus, you have been a juror in tons of hackathons right now, and are also, yes, Jesus is writing yes, and is also quite aware what early stage companies could deliver, especially in a hackathon like this after 5 days of intense hacking, for instance. And we are aware that in this short period of time, if you form a new team, you won't have a perfect product. Yeah, Jesus has like 50 hackathons in the past 2 years. So if that is not a pro, I don't know. I hope that answered the question.
I think it's hopefully done so. I think you've covered a lot there. So thank you very much, Maren, for going into detail on various parts there. And yes, I can see Jasmine's just written thank you as well. I'm conscious of the time. I'm going to suggest we quickly whiz through these last 3 questions, and then we must jump into Takai and have a good walk through. So the 3 questions. In relation to the scholarship agreement, is it possible for team members to have solo proprietorships, freelance, or be self-employed in another country, e.g. Poland, and pay health insurance in this country? Lucy, would you mind quickly addressing that one, please?
So you can still have some side jobs. Usually we say for a maximum of 5 hours a week. So it doesn't, let's say, doesn't disturb your attendance or like your involvement within your startup journey, and here also for the program. So it's still possible for you to get this side involvement or side projects. But again, it's a full-time program. So developing a startup also takes time. So as long as it's limited and you can also manage both, then it's okay for us. And for the health insurance, so you can still keep your private health insurance in Poland, for example, as long as it covers also, I guess, in Germany. So you don't need, or it's not an obligation for you to enter into the public health care system here in Germany. You can still keep the private one that covers also your insurance here outside of Poland. So probably Germany or Europe in general. So that's fine. That's something you have to check also by yourself.
Excellent. Thank you, Lucy. Another one, I think you could be good to address this one. Are those that have been awarded with public grants from a different federal state in the past eligible to participate in the incubator and receive the scholarship?
I'm actually not sure about that one. Maren probably knows better.
I think it depends what kind of public grant it is. So from a stage point of view, our public grants are for early stage entrepreneurs. And of course, the qualification trainings and support we offer are sometimes comparable to support, not just public grant support, but other support from a different federal state. Of course, there's always the question, why should you run through the same process again, have the same workshops, get the same methodology taught, maybe also meet the same people? Would it be a waste of time if you go through the same process again? This is one topic. So I think this would be something that we would have to look into. The second topic is that some grants are actually aiming for later stage companies like Exist, for instance. So usually the Berlin Startup Scholarship comes before Exist, because Exist is tailored for more mature companies. Their product is usually a little bit further. So if you already received Exist, technically the Exist guys, which is a different funding scheme in Germany, gave you the stamp of approval that you're much further than early stage. So they actually tell you, based on the grant that you receive, that you're more mature than the companies that we usually support. You could feel like, hey, no, this is not the case. But from a funding point of view, Exist is usually a funding that comes afterwards, because it also aims to growing the company, scaling the product much further, while our incubator is very much gearing up to validating a product idea, moving the product idea into a strong prototype and MVP, and maybe even launching the product on the market, while Exist is usually moving in the next step or supporting in the next step. So it depends a little bit what kind of scholarship it is, but technically, if it's an accelerator, an incubator, a publicly funded program that helps you to, come up with the idea, and maybe it's much shorter than ours, has not the same concept, then of course they would not be comparable, and then it would be completely fine from a Vision Health Pioneers incubator if you join our incubator as well, and continue the journey that you start with the other program. But feel free to also send us a very specific message. There are some programs out there that are, in earlier than us. It's usually programs like Founders Institute, Antler, Entrepreneurs First, that focus on forming a team and coming up with ideas. When the teams ran through a 3-month program, we usually then come and say, okay, now we focus on the product, helping you to enter a very specific market, while Antler, Entrepreneurs First, and Founders Foundation are usually not very focused on the healthcare market. There might be a team with a healthcare focus from Antler, Entrepreneurs First, but they don't have a cohort system where all the teams are in healthcare in a similar situation. We do. So all our startups are healthcare startups. All our startups also benefit from each other. And this is the reason why we also usually, a next step, if you come from a program like Antler, Entrepreneurs First, or Founders Institute, just to give you a few names or a few programs that we work with in the past, and also like a startup journey that we have seen that teams also benefited from. I hope that answered most of the question. Excellent.
I'm sure it did, Maren. It was great detail. So we'll go for a final question, and it's a good one to end on as such, and then we'll go through Takai. What are the next steps or the first steps in the coming days? I previously filled an application of success and registered on Takai. So I think, Maren, if you mind answering that one, please.
So if you already uploaded your information on F6S, you would basically copy your information into Takai. And I can show you exactly how it works. So again, you want to be part of the deal. If your team is not 4 team members, which is the maximum team number, you can use the hackathon as an opportunity to actually find different team members and contribute and be more active in the matching activities, the meetups that come up. If your team is complete, if you're registered on F6S, if you come if you're registered on Taika, if you come from F6S, you could basically lean back. You join us on the 16th of May when we kick off. I think you still have to decide, do you want to hack in person with us? You can look into the resources we provide. Maybe there's data, maybe there are resources that you could also use during the hackathon week to actually bring your product, your idea to a next step. You could also look into the workshops to decide which content is something that is relevant for you. If you have known everything and you schedule 2 mentor sessions and have been part of 2 workshops and everything is fine, you only have to qualify for the pitch. How to qualify for the pitch is by adding all information that you, in your case, might have selected already during the F6S project into Taikai in a certain page that is only on your product and your project. Then you submit, and 2 hours later, I think, the jury member requests you to present what you either uploaded on F6S already or what you have put onto Taikai to the jury we selected. And at the end of that day, at the end of the 20th of May, when we push the button and the tokens are added up, you will know if you are part of the top teams that are eligible and can also join the Vision Health Pioneers Incubator. So it's a quite public and transparent activity, but it also requires you to be on your best in the hacking week, and especially during the pitch session on the 20th, because it's even more important that this presentation at the end of the week counts. It will be visible, you will be compared to other teams. And I think this is a more competitive situation than we had before, but it also gives you the opportunity to really show off. So I can quickly guide you through F6S and to Taika, and I think it makes it then also a little bit more understandable for you. And again, for the ones that have not added any information on Taika on F6S before, you would either create this information anew during a hackathon, you would use existing pitch decks, for instance, but you would add similar information to the Taika platform, to our hackathon. But of course, you would have a little shorter time to prepare because everybody that dived deeper into F6S had, I think, a little bit more time to work on the presentation. We also want you to be very clear, because it sounds like we are comparing apples and oranges. We want you to clearly also outline, did you enter the hackathon as a complete team with an idea that already exists? Or have you founded the team, came up with the idea during the hackathon, because we will take that into account with all the scoring, with all the pitching, with all the jury activities that we have. So especially the teams that form anew, you will not have a disadvantage. But you might have to invest a little bit more time during the hackathon to generate the content that the guys that applied via F6S already, uploaded. I think this is the only difference. Let me quickly share my screen so you can also understand how much content we are thinking about. So if you would go into the Taika Platinum, you see there are a lot of different hackathons happening, and I think my colleague Caroline already shared a link in the chat. So this link should guide you directly to this platform. This is the platform at Taika. You would register here, and there would be a form that opens up. I can't do it anymore because I'm already registered. But you see, I have 0 token. So I never attended in a hackathon. So I also did not battle. I did not win. And this is the reason why I don't have any tokens, but I can also show you some positive examples from a past hackathon that we did. So once you're registered, you see the opportunity here to join Slack. We have a Slack group. It's an open channel, it's a pro channel, so it also gives you the opportunity, to add data, to meet people, but also to do video calls and upload information during the hackathon, but also beforehand. And then you also have some information about the hackathon itself. We have already 12 participants, and also some reasons to some of the information that you heard before. You also see the timeline, and don't be scared. So this is the timeline in general. You could also add all these events to your calendar to better figure out what works. And then you see this long list of activities. But you also see that it's something like at that time, the project should be public and enabled. We have morning stand-ups that you can join, but do not have to join. You see the multiple workshops happening. And of course, you can also say, I'm not interested in team culture because this is maybe something that our team did before, but the monetization models in digital health, which is, as far as I know, also run by a representative of Sana clinics, an interesting contact for you as well, might be something you want to dive a little deeper into. Or you say, hey, I really want to join the location at Driver Berlin. I want to do it in person. So you would join us on the 18th of May for the kickoff in the physical space. If you join remotely online, this would be, for instance, an agenda point that you don't have. Then we have, and this is something that Johannes Stanley is going to do, a workshop on data and medical regulatory. Here's a Zoom link, so you can decide if you want to join. But keep in mind, out of the, I would say, 4 workshops that we do, you should attend one. We also have morning stand-ups. As I said, we have mentor booster sessions. In that time, mentors are available. But of course, you don't have to spend 2 hours talking to mentors. If you don't have time, you can actually, budget your time and decide what will be a good timing. So out of this, you basically also choose. And then there's a pitch time that happens on May 20th, which is a Friday in the afternoon. and between 6 and 7, I guess, because we are never on time, you will definitely get the final information. In this tab, in the rules tab, there's a lot of things, terms and conditions, AGBs in German written down. So you also see how you have to register. Please, every team member that wants to be eligible for the Vision Health Pioneers Incubator needs to register, not as a team, but you also see the most relevant activities, and you see selection process. So what are we looking for? I think this was something that Jasmine said. So problem solution fit, the level of innovation, also how sophisticated is that, how complex is it, can we support? In the first cohort, we had a company that wanted to do stem cell technology in our fridge. And to be honest, I mean, we are not equipped for that. So as an incubator, of course, we can only help to a certain extent. But I think we are not comfortable with certain in vitro solutions that our co-working space, but also our network could not support. Are you able to tell your story? Also, are you able to tell us how great you are? And then, of course, also, could that solution be brought into life? Is it impactful? Is it original? Do we have 20 different teams in our incubator tackling the same topic already? We also don't want to create competition within our cohorts. And of course, then the other question is eligibility. So you can go through that, and you also see certain rules that we set up, liability, of course, just to make it also more controllable for you. Then we do have the prices. It's 20,000 euro per person. If 4 team members join, it's 80,000. But it could also be 2 team members, could also be 3 team members. So this also means we have budget for a minimum of 10 people. It could be 2 teams with 4 team members and then a smaller team with like 2, but it also could be 5 teams with 2 team members. Just keep that in mind. And what we usually do is we are quite transparent, and we will communicate throughout the hackathon as well. What's the team situation? How many teams are in the pipeline? How many teams are actually working? And how do we count that? By actually looking into the projects. That tab is basically a tab that shows us which teams, which startups are working on. It's not called startups because in most hackathons, you work on a team, as a team, on a project, on a problem that you identify. So this is the reason it's not called startups. And you would go into that, you would see different team members, but of course, this is also something that I can show you in a past hackathon. This is also your opportunity to ask new team members to join, because it's like, your business case, your business card saying all the information, everything that's relevant on your project. And the jury members at the end would also look into that to have you pitching, but also see some written information about you. You have the tab with the participants. Here there's Stella. Stella is looking for a team. So she's the sole and only founder. She's into UX design, UI design, and problem solving. Pretty cool, but she doesn't have a project yet. And then you have a team like SensiVR. So here's Robo. This is also the task. And again, that team might have additional team members that are not listed here, but the team is not looking for an additional team member right now, because otherwise it would be also here something indicated like recruiting. So you as a person that register, you can also go into there, check out who is looking for a team, is that person fitting? You could reach out to that person, you could send a message, and also without any meetups, try to connect. Then you have the categories, which are basically the challenges. You have 2 right now. So you would click on it, you would have more information. You also have a link. You can use that as an inspiration if you don't have your own idea, and we will add more challenges, more topics step by step. So you can also decide if you want to work on something like this. Again, Lohmann and Rauscher would be a partner that could also support you during the hackathon, but also afterwards in the incubator. Matchmaking. Here are open positions usually listed. Since none of the projects right now have listed open positions, of course, that will be added. You would then click, if you are a lonely soldier and look for a team, into the open positions. You would basically check out if the team is interesting for you, yes or no. And then you have the resources. I think it might be also quite interesting for you to decide if it's worth joining. because you will also see what are the links that we provide, what are the development frameworks we recommend, what are the general dev tools we recommend, but we also have information about healthcare. So where do you get certain data sets that might help you to actually add a new layer to your idea. And you could also use that, of course, to get a better understanding what's the project and the problem all about. Then you have the FAQs. You know, some questions we gained already, and we can add more from today. Then you have updates, which are messages that are usually sent from us. So there are no messages, but if we send a message, a central message, everybody that registered for that hackathon will get that message. The jury, I think, is still empty. They're going to come because we will onboard them. And there will also a different tab on the mentors. You can see what the mentors are all about. And at the end, you will also see transactions. Let me show you a little bit more about a previous hackathon that we did for the Applied Data Incubator, just to give you an understanding about the project. So there were multiple projects in the making. You also see here the number of tokens that this project achieved. So you also see that this is a project that had open positions. So if you go to that project, you would see what the project is all about, who works on the project, and also have some more information. So this is what a juror would see at the end. If there are a little bit more people on that platform, you would also see all the participants. Not anymore because it's a closed one. And then you can also, of course, see all the updates, and you would also see the results. So you would see which team had reached the highest number of tokens. And you would also see, if you click on that, which juror give that. So 8 jurors, generated close to 10,000 tokens for that team because they really like the team. And you would also see who that is and who was most critical and who was not so critical. So this is the reason why we also work with Taikai, because of course it gives you also an opportunity of more transparency. It gives you the opportunity to actually learn more about yourself, have via blockchain, and the results will stay in the chain. Also always the opportunity to check why was my score for maybe lower than on other hackathons, and what could I use to improve the work that I do. So use it as an opportunity. The platform will be open. I think it will be closed on the 16th of May. It's for free, so you don't have to add your credit card details, it's accessible if the projects are in private, which the team lead can decide. Only you would see behind the project. I have a little bit more power because I'm an admin, but of course this is an opportunity also for the jury, for the mentors, for the coaches to get to know you a little bit better. If you do have any questions related to Taikai, let us know. We are quite open to also give you feedback. I think there's also a wiki how to use Taikai in case you have technical issues. Feel free to reach out to Ben, Caroline, my colleague, or even Annick, and then we can help you to get on board. Some of you are already on board. So I think if you have a technical issue, just ping us.
Excellent. Thank you very much, Maren. And hopefully everyone got more of a feel for Taikai, the home of the Vision Health Pioneers Hackathon. So with that, thank you everyone very much for joining us today. We really appreciate your time. We really appreciate all the questions that you had. Hopefully we've answered them. As Maren said, if you have any further questions, please do reach out to us and we can answer those. So with that, thank you very much to all our special guests as well, and all the team for sharing the knowledge. And we wish you all a very good rest of your day. So thank you and goodbye.
Ciao, ciao.
Bye.